let's just define an HISP first. A HISP is a Health Information Service Provider, and that really is your provider of secure messaging. Who is going to provide my secure messaging? Who's going to handle the certificates and the identity validation? And when you're picking someone like that, there's some things that I really recommend. The first is look for someone who has some experience in secure messaging. It isn't just about email. It's about someone who understands communication at its core and securing that communication at its core. So I would look at someone who has some experience in the industry. The second thing is to look at someone who is capable of growing the messages at scale. Direct secure messaging is likely to become the default communication mechanism in healthcare across the board. It's secure, it meets all the requirements of HIPAA. It's going to grow. Does the provider, the HISP you're looking for, have the ability to grow as the message volume grows? It's one thing to say we're going to exchange 100 messages. It's another to say we're going to exchange 20,000 messages an hour. And so do they have the capability of handling that volume? The third thing I look for is someone who really is able to provide carrier-grade support. Because when we start talking about deploying direct secure messaging at the provider, there are 4 million providers in the nation. Do you have the ability to communicate and provide for that information?